Hi, I'm your host, Mark Karen, and welcome to In Focus by U Multicultural, where we focus on civic issues here in Winnipeg. And in today's episode, we'll be talking to Southeast Personal Care Home on how COVID-19 affected their workplace and how they're handling all the restrictions and the guidelines of it. With me right now is Kevin Friesen from Southeast Personal Care Home. Kevin, how are you doing today?
Very good, thank you.
So, can you give us a brief description about yourself?
Sure. I'm the executive director, director of care at Southeast Personal Care Home, which is an 80-bed First Nation owned and operated personal care home here in Winnipeg.
And what were your thoughts when COVID first hit, being working as in a personal care home?
Well, we were especially concerned being in pretty much everybody working in a care home because we have a very vulnerable population that's high risk for severe illness from COVID. So I think that was a general feeling. We put all precautions in place immediately and took steps we needed to keep our residents as safe as we possibly could.
And what were the struggles of working in a retirement home during the pandemic? Because it's like apparently it's been affecting mostly elder people. So how's it been? What were the struggles of working during that time?
Well, it's just a very different from our normal there with all the infection control uh, efforts put in place, wearing masks, adjusting our recreational programming to make sure people are physically distanced.
Mhm.
Uh, it's infection control has become such an important part of our day-to-day lives here that we really had to go about things in a different way. It's been about a year since we've implemented, so it's pretty much become our new normal right now. We're rolling out the second vaccinations for our population here, which will be good, but infection control measures will still continue to be in place for this foreseeable future.
And what will happen if the COVID-19 restrictions don't lighten up and like the cases get worse?
Well, we continue as that we're prepared for, that's kind of how we're living now is that the risk is there every day. So we would continue with measures like all staff uh, wearing masks, eye protection, keeping everybody physically distanced, including staff from each other whenever possible. We would also visitor restrictions. We limit it to the essential visitors,
Mhm.
and it wouldn't be in the common areas; it'd be in the rooms. We also have a external visitation structure that, when things are really high risk out there, that we use that instead of in facility visits. And those are the type of things we'd have to continue doing. If things get worse, or if the vaccine doesn't reduce the numbers significantly out in the community.
And how are you and your employees like feeling with the COVID restrictions? Because like it can affect them and their family as well.
Yeah, I think it's stressful on everybody because it not only affects how we're working here, but it
Mhm.
also affects how everybody's living out in the community. So the staff, they are concerned about the safety of their own families. We have a good portion of our staff that have gone for their vaccines already, so that helps. But we take precautions, like staff change their clothes when they arrive and they change again before they leave. We encourage them all to follow the public health orders and that. But it is just like for anybody else, it is a stressful time. Uh, you think back to a year ago compared to now, simple things like going to the store is much different,
Mhm.
and going to a restaurant is rare nowadays. Although they're just coming back in. So, but I think the staff have adapted well. We've tried to support them in every way we can.
And how is government helping the retirement home during these difficult times?
But we've received a lot of assistance from the WRHA in the way of providing supplies that we needed, the personal protective equipment. When we had an outbreak, a site lead being on site here to help us guide us through the measures we needed to take. The external visitation structure was a government implementation. So they've been, and we have daily
Hmm.
teleconferences with the region and other sites. So they've been very involved and very active in helping us out.
Well, thank you so much time for your time, Kevin.
Thank you.
Mm. Well, that's it for today's episode of In Focus by U Multicultural. I'm your host, Mark Aaron, and special thank you to Kevin Friesen of Southeast Personal Care Home for his time. Hope you stay safe and have a nice day.